Good afternoon once again. Today is Wednesday, the 1st of December 2021, and this is the English language summary at the press briefing here at the Center for COVID Situation Administration for the 1st of December today. Thank you, Dr. Tui Sin, for the information in the Thai language version. One of the charts that he showed us portrayed a downhill slope graph in terms of the infections in Thailand, which is quite good news. However, of course, there are still a lot of things that we have to work on. One thing, of course, is the Thailand Pass and the measures for travelers entering the country. This continues to be an issue that we have to look at every day in comparison to the situation on the ground, the real situation on the ground that we have on hand. So first off, one development is that yesterday, on Tuesday, which is the weekly cabinet meeting, the cabinet approved that all people entering the country via the Test&Go scheme must take the RT-PCR test as usual. This was considered as our precaution, a precautionary step to cope with the new COVID-19 variant of concern, as you know, Omicron. Now, the cabinet approved this. As you recall, if you heard the briefing last week, that was the plan as proposed by the CCSA to change from the RT-PCR requirement for all travelers coming into Thailand to ATK. Now that, of course, as I've mentioned, has been reversed, and the approval to take the RT-PCR test as usual is now in place. So just would like to once again briefly highlight on the new measures for travelers entering Thailand on different schemes starting from the 16th of December onwards. Now please note that this is not related to the travelers in the travelers coming from the 8 risk countries from the African continent. This is for the general all other travelers. So just to summarize in simple terms, number one, upon arrival in Thailand, travelers on the Test&Go scheme are required to take the RT-PCR test as usual. Number two, travelers entering Thailand via the Sandbox scheme are required to stay within the Sandbox zone for only 5 days instead of 7 days. And the only adjustment is the quarantine period, while other measures remain unchanged. And number three, the shortened quarantine period is also applied to travelers on alternative quarantine or AQ. Only 5 days of quarantine is required if you are fully vaccinated, and 10-day period if you are not. However, these measures are subject to change and revision at any time depending on the current day-to-day situation, as we all know. So all travelers are recommended to closely follow the news regarding this matter. Now let's move to the update on the entry into Thailand. We have a slide coming up for you here. As of 9 a.m. today, the 1st of December, we have logged a total of 337,988 applications on the Thailand Pass system. And of that number, a total of 268,799 have been approved. Actually, the majority. And of which 138,375 were auto-approved. Now, from another slide that we have will concern the numbers for the 1st to the 28th of November. Sorry, the 30th of November. We have here 133,061 travelers who entered Thailand in total, approximately for the whole duration of the month of November. And of this number, the majority, 106,211 travelers, entered via the Test&Go or the quarantine exemption scheme. And we have 21,438 entering via the Sandbox scheme in the Sandbox pilot provinces. And we have 5,412 entering through the normal regular quarantine. Now, the majority of international travelers come from these top 10 countries of origin, namely the United States, Germany, Netherlands, UK, Japan, France, the Republic of Korea, the UAE, and Israel. Out of the total number of travelers, only 171 tested positive for COVID-19, or 0.13%. And you can take a look at the infographic that we have on screen for you with those numbers in place. Now this recaps actually the entire month, past month of November. Yes, there. So we have now the issue of the vaccination progress. We have yesterday administered 573,073 doses of vaccine. And you see that in the center column there. That was for yesterday alone, making the accumulated number of vaccinations in Thailand to more than 93 million doses already, almost close to 100,000 doses. 93,231,463 doses. Now we have, in some terms of percentage, 67.1% as those in Thailand's population having now received their first dose, 67%. And we have 57.6%, or more than 41 million people in Thailand now having received their second dose. 41 million people, almost 58% of the entire population now having completed their second dose. Turning to the general situation for today, we have new confirmed case at 4,886 cases. As compared to the new recoveries, which now far exceeds the new confirmed case on a daily basis. New recoveries, we have over 6,326 cases. The active cases still being treated at the moment is 74,190. This number of active cases still being treated in hospitals and facilities continues to decline at a steady rate, which is very good news for us. And of this number, 1,351 are considered as COVID-19 patients in critical condition. And of that number, 340 are patients on ventilators. We have new fatalities at 43, unfortunately 43 new fatalities. And coming up on screen for you now, we'll have the provinces that have the top number of cases in terms of COVID-19 infections. As you can see, Bangkok tops the list, has been topping the list for quite some time already. For today, for example, we have new cases in Bangkok at 794, which is higher than the previous day because it's in red. And in Surat Thani province, for example, 240, that's in green because it's less than the previous day. So Bangkok and some provinces in the southern part of Thailand, as well as other provinces around the country, continue to make the top 10 list. If you look at it from one perspective, the Bangkok number is 700, is the highest in terms of the provincial distribution. But it is actually not a very high number when compared to the population of Bangkok. So therefore, we hope to see this trend continue. As I mentioned in the beginning, the downward slope of the graph that we have in terms of the infection, hoping that it will become a steeper slope in the days and weeks ahead. So moving on to the measures, the adjustment of the measures in Bangkok in particular. We have, firstly, I'd just like to mention that Dr. Tweesin talked about the SHA standard, SHA and SHA plus, wherein in Bangkok, actually, there still remains some establishments which, of course, need to do more to reach the SHA or SHA plus standard. Now, with the SHA standard for restaurants and facilities and establishments, SHA in Bangkok now we have numbering 9,196 establishments which were qualified already in the SHA standard. But for the SHA plus standard, a higher standard requiring vaccinations of employees, for the SHA plus standard, there are around 1,600 establishments that have been qualified for the SHA plus standard. So therefore, you can see the difference that over 9,000 is SHA, but only 1,006 is SHA plus. So therefore, these establishments obviously need to do more to reach the SHA and SHA plus standards. This is also, of course, related to the establishments that can sell alcohol in the future. They would have to have SHA standard. So that's a strict requirement that we have set up for establishments in Bangkok. So hoping that there will be more SHA establishments and SHA plus establishments in the Bangkok area. Now, returning to the slide, can I have the slide coming back again? Yes. We have the Bangkok Metropolitan Administration, or BMA, announcing that from the 1st of December onwards, which is today, that the drinking of alcohol at restaurants will be allowed to continue until the time of 2300 hours or 11 p.m. However, the entertainment venues will remain closed until the 31st of December or until further notice. Now, of course, having alcohol in restaurants and establishments, those restaurants and establishments have to be qualified for the SHA standard as mentioned. And meanwhile, competitions or other sports activities can resume. But of course, the organizer of these sports events need to receive permission from the Ministry of Public Health before any activities can be held. And you have this infographic on screen for you, courtesy of the Public Relations Department, recapping about the measures in the Bangkok metropolitan area, the Communicable Disease Committee of BMA, and their 3-point resolution, recapping for you what I mentioned just now. So moving on to the update on the Omicron variant. As many people have expressed concerns about whether the RT-PCR test method will be able to detect Omicron variant or not, the public health authorities of Thailand have now confirmed that the RT-PCR method is still capable of detecting the new variant of concern, and the method is still in use globally. And as of today, the Department of Medical Services of the Public Health Ministry of Thailand has not yet discovered the Omicron variant from samples collected since Thailand's reopening to international visitors on the 1st of November. So no Omicron variant discovered yet in Thailand. All of the said samples comprised of Delta variant and sub-variants. And if the Omicron variants make their way into the country, hopefully in the unlikely case, such unlikely case, the Department of Medical Services will quickly discover them, as the variant identification process at 15 medical science centers nationwide is now being adjusted to focus on the Omicron variant. So if there is, most likely it will be discovered quite quickly and dealt with. And yesterday, the Deputy Public Health Minister also urged the public not to panic, emphasizing that the Prime Minister has ordered security agencies to intensify border surveillance to prevent illegal border crossings in order to help keep the virus out of the kingdom, keep the virus at bay. And also, the government has instructed relevant agencies to monitor the situation of Omicron very, very closely. The measures will be reviewed based on the new information coming in, and of course, tougher measures will be quickly considered if there are any urgent cases. So as you can see, it's a very dynamic situation, but we're keeping a very strict control, a very close control, a tab on it in terms of our prevention frameworks, in terms of the measures that we have put in place ever since the weekend news and information that we received regarding the Omicron situation around the world. So before closing today, I'd just like to highlight the importance for all people living in Thailand to continue to follow the guidelines of universal protection. It is very relevant, even more relevant today, this week, because of the new variant of concern, which has struck us quite as a surprise, I would say. Many countries have had to reverse or change their policy or measures, all kinds of measures, domestic measures, or in terms of people entering the country, the control. Many countries have had to do that, and likewise, it's what we have been focusing on. And we can only return to the normal lifestyle only if we fully comply with the health measures put in place for the safety of everyone in the country. So with that note, I thank you very much again today. Please take care and stay safe, and we'll see you again next time. สวัสดีครับ
ครับขอบพระคุณนะครับ